Hello again. This is the South African Morning. Now, there's a worrying rise in drug and alcohol abuse among the youth. That's according to data from the 58th Community Epidemiology Network on Drug Use Symposium. It's recorded a spike in voluntary admissions to care centers among teenagers aged 15 to 19. Gauteng is leading the trend. Well, for more on this, I'm joined now by Nancy Hornsby, Senior Scientist at the South African Medical Research Council. Thank you very much, Nancy. Welcome to the South African Morning. What are the key findings here?
Morning to you and your viewers. Thanks for having me. So as you indicated, we see an alarming trend in admissions among youth aged 15 to 19 specifically. So where before, in previous years, mostly admissions were made among adults and young adults between the ages of 20 to 34 years. Over the last 3 periods or so, we are seeing this picture changing with most admissions among adolescents, and they are mostly males, and almost half of them are unemployed, while 26% are school learners, 48% are unemployed. And so we're seeing this picture changing from mostly adults accessing treatment for substance misuse to adolescents.
Yeah, well, it is good to know that you're picking up from the care centers. They are accessing the care centers. They're needing help. There is a concern, of course, about this trend. And are there key drivers? What do you find are the key drivers? You've said, for example, many of them are unemployed, which means that could be a factor. And there are other socio-economic factors.
So what I should have mentioned earlier is also the main substances that we're seeing youth seeking treatment for. So it's mainly for cannabis. This is nationally. And we see the same profile for Gauteng, as you said at the beginning, that Gauteng is accounting for over half of the picture that we see. And that could be because of urbanization. Gauteng has a larger rate of urbanization. But as to your question around what are potential drivers or factors, it's a very complex issue. And it pertains to individual factors. So we know adolescence as a specifically vulnerable period. So they are still developing, physically and both neurodevelopmentally, and they're more prone to risk-taking, to seeking, to reward-seeking behavior. So they tend to take dangerous decisions and not taking into account the consequences of these decisions. So they're more likely to engage in risky behaviors like substance use. But then there's also systemic factors, so community, family, peer influence, is the easy access within the community to substances. So those are all of the influences that together can serve as either protective or risk factors.
Well, from the research, have you been able to glean why Gauteng is leading the trend among the young people?
Mm-hmm. So as I said a minute ago, we do know that Gauteng has a higher rate of urbanization. And so in urban areas, there's higher or easier access and easy availability to substances compared to other areas that might not be as developed.
Okay.
It could also,
Yeah. So what do you hope will be done? I mean, you are the researchers, you are the scientists, you are making these findings. Of course, I mean, there has to be some sort of interventions, I guess.
Mm-hmm. That's a very important question. Our message is early prevention. So it's about preventing or intervening at an early stage before the issue becomes disordered, before substance use becomes disordered. So it's intervening when substance use is maybe still at a recreational level. So it's, family, parents, educating, because we know young people are misinformed. They tend to get the information from peers, but if that's the incorrect information, that makes them more vulnerable to taking up these behaviors. So early intervention, but also starting at a school level. So if Department of Education, for example, could include substance use and its health consequences at a foundational level, and policy, we need to have the appetite. So, I mean, the appetite is there. For Department of Social Development has been fantastic in tracking and using our data, but the decision makers, we need to have these changes at a policy level.
Okay, thank you very much for your insights this morning, unpacking some of your key findings, the very important study. That's Nancy Hornsby, Senior Scientist at the South African Medical Research Council. She's in the Mental Health, Alcohol and Substance Abuse and Tobacco Research Unit. Now, this story, a scathing Human Rights Commission report